Welcome to Thrive with Dr. Varsha. Today's topic is about what are the career opportunities for PharmD graduates. First is academics. Once you have completed your PharmD, you can join yourself into your own institute as well as any other institute as an assistant professor, and then later on you can get an higher position. And if you want to continue your further education, if you want to pursue PhD, then you can, after completing your PhD, then you can get at higher position with a good salary. Then in hospital, you can work as a clinical pharmacist. What are the job roles, what they do in everyday basis, as well as what are their roles. I will let you know. I'm going to make video on that. So please look forward to it. Then patient educator. You can work as a patient educator. You can guide on medicines and diseases. Medication team management. Those those professionals who are included regarding medicines, you will manage those team. Then who will be those people? They are nurses, pharmacists and physicians. You will monitor and manage that team. Then forensic pharmacies, use of drugs or any medical products in and legal issues, that will be included under forensic pharmacy. Then when the patient get admitted, the hospital charges, hospital services, lab services. So the patient should be beneficial by and medical service, medical products and the drugs. That all will be monitored by a pharmacoepidemiologist. Then medical affairs. It's a huge domain where medical representative MR. What does MR do? They sell their product to physician. Whatever they will explain in a sales language. How much was the sale of this drug, they will explain regarding this to an physician. What is difference between MR and MSL? I'll let you know. MSL is medical science liaison. What they do, they are the liaison between an industry or a company and a physician. They will provide scientific information to physician. So whatever the indication is of that drug, they will explain that mechanism of action, pharmacology of that drug, then therapeutics, complete therapeutics of that drug, they will explain that to a physician. Then medical coding. When a patient is admitted to an hospital till it gets discharged, whatever the data of that patient is there, that will get collected as like drugs that are prescribed, physician notes, lab values, that all will get combined and they will get transcribed into a medical language and that will be coded. Then medical writing. Whatever domains we have seen where PharmDs can work and whatever we will see further, then whatever companies, government bodies or any or any government body has to publish and medical and scientific data in a written format, you can tell that it has written by a medical writer. That is the work of medical writing. I'll let you know. In clinical trials, you can see whatever the clinical trials papers has been published, that has been done by medical writer. Then uh, any company has invented any product, then regarding that product, all the information will be written by a medical writer. When you buy any drug, there is a leaflet in that box that has written by a medical writer. Then medical transcription. In for any physician doesn't have time, then what that physician will do, they will hire a medical transcriber. What that transcriber will do, they will get a call from physician. Whatever drugs they are telling them, they have to prescribe that medicines, they have to write, that is transcribing, they have to write it and they have to submit that data to an particular institute. Medical reviewer, medical editor, from that word you can see what are their job roles. They have to review all the scientific data of that company or that institute wherever they are working. And medical editor is like they have to create and edit that layout or the scientific layout and for whatever data they have to publish. Regulatory affairs. So regulatory affairs is again a body between an government as well as a company. They are a middleman between that government and an industry. So whatever the protocols, rules and laws will be given by a government to run any company, to run any product or a device, those rules will be monitored by a regulatory affairs body regarding that company, whether they are following that or not, and whatever the concerns of that company, that again will get transferred by regulatory affairs to that government body. I hope that is clear. Pharmacovigilance, anything related to ADR. So from detection of that ADR is adverse drug reaction, from detection of that ADR to monitoring that ADR and then reporting it, all is done by pharmacovigilance. Then drug inspector. So from junior level to an senior level, this position keep on changing, means the sites keep on changing. That is, you will be drug inspector regarding community pharmacy, you will be drug inspector regarding that company, regarding that industry, regarding that manufacturing site. Then what you will do, you will see whether protocols, laws and malpractices are being done in that community pharmacy or in that industry or that company. You will monitor that, you will keep check on that. So that is the job role of drug inspector. Clinical research, clinical research scientist. So from drug discovery to manufacturing it into an actual drug will be done by a clinical research scientist. Investigator, so conducting a clinical trial will be done by an investigator, then submitting all the protocols and laws to an clinical site as well as from clinical site to that government body will be done by an investigator, submitting results to government body will be done by investigator. Clinical research associate, that is, they will monitor clinical trial and supply whatever it is needed in that clinical trial, that will be done by clinical research associate. Clinical research coordinator, contract research coordinator, these are same, just when I say contract, that is on, they will be on contract basis and their sites keep on changing, and they are the juniors of clinical research associate. So their work will be same, but they will do that work on daily basis. Further education, you can pursue your further education in many things. I'll just enlist few. That is MPH, Master of Public Health. It will be for 2 years. Then you can work in an company, you will get a good position, and if you want to, then you can work as a physician assistant. um, then PhD in whatever domain you feel like, you can pursue your PhD in that. Healthcare MBA, it will be for 2 years, and after that you can work in MNCs. Then fellowship, AMS, antimicrobial stewardship. Not all hospital have this domain, but it should have, but it doesn't have. But if you want to continue your education, or if you want to continue your career in foreign countries, then you can take this, because handling and monitoring and working with antibiotics is a huge task, and it needs a specialization, and you will be doing that specialization, that will be a beneficial for you. So so you can think of that. Tata fellowship, it's in oncology. Eligibility for this is MBBS and PharmDs. For both of them, they provide stipend. For PharmDs, it is around 55,000. It will be for 2 years. An MCQ based exam. You need to crack that exam, and after that there is an interview. You need to crack that interview too, and the position is only for one person. So out of 1,000 people, only one person will get selected for that fellowship in oncology, and once you completed that, then you can get a good position in a good company, as well as you will get a good salary. community pharmacy. So this is like you can open your own business, but what will be the difference in other community pharmacies and your community pharmacy? When a PharmD opens a community pharmacy, then you can patient counsel each and every patient whenever they buy any drugs or any medical devices, because we have been taught of that, as well as it's in our curriculum and we are professional in that because it's our thing to patient counseling, and that will make a difference. Thank you so much for joining me today. I hope I must have cleared your doubts. If you have any doubts again regarding this, please let me know in comment section below, or even you can email me, or you can message me on in my Instagram as well as on LinkedIn. I will answer that for sure. And if you find this video insightful, please like, share and subscribe. Thank you. Bye bye.